But first, let's get the latest with the COVID situation in New South Wales and a look at the latest numbers in Sydney. It looks like the lockdown now will extend well beyond the 4th week at least. 77 new cases today. In total, 566 since this latest wave started. Tonight, 52 people are in hospital and 15 in intensive care. One woman in her 90s has died. Of the people in hospital, 23 are under the age of 55, 11 under the age of 35, and 6 are under the age of 25. The Premier, being upfront today, said the situation is likely to get worse before it gets better, and right now there's no end in sight to the lockdown that she could give.
I fear that tomorrow and the few days afterwards will be worse, much worse than what we've seen today. But what we need to be assured of is that the tide will turn once the impact of the changes we've made come to fruition.
Defence Minister Peter Dutton has warned the Delta variant is affecting young people more than the original COVID strain.
This Delta strain is targeting younger people than the Alpha strain started out doing, so we need to be very mindful of this.
To hammer the message home, the government has released a shocking advert to tell people that this is not just an old person's disease, and to warn you, this is graphic. I have to say that advert is likely to terrify young people who currently are not eligible for the vaccination unless they get their doctor's permission to have the AstraZeneca. They are not eligible for the Pfizer vaccine because there are not enough supplies. So that decision that the government has taken to truly shock and terrify, that is an ad provoking fear in young people. It will cause young people to be frightened, and yet they are not able to get the vaccine at the moment. There is likely to be backlash to that. The health officials, however, have started to recommend in New South Wales that people bring forward the second dose of AstraZeneca to the 6-week mark rather than wait for the full 12 weeks.
We are recommending that whilst the interval was that 3 months at this time, because we are seeing case numbers high, we want to get people to come forward, and you can get vaccinated around that 6 weeks mark. We know that for the Delta variant, you need those 2 doses.
Looking at the situation globally, it's not just Australia that is struggling to contain the Delta variant. There's been a resurgence in cases in Indonesia, Greece, Netherlands, Portugal and Spain, and even the UK, where we know there are such high vaccination rates. They've got their highest ever level of COVID cases. This is a very clear indication that we are going to be dealing with COVID-19 and its variants for years to come, even after the vaccination rollout. A virus that emerged in Wuhan, and we still haven't had a credible investigation into why it broke out and what happened. The New South Wales Premier Gladys Berejiklian says we will only open up when there are close to 0 cases in the community. If she sticks to this goal, it seems that we're looking at a very long winter in New South Wales in lockdown. The situation is certainly putting our political leaders under a great deal of pressure. Gladys Berejiklian herself is under fire now for not locking down sooner and letting this get out of control when epidemiologists, were calling for a short, sharp lockdown at least a fortnight ago. Others, meanwhile, oppose her decision to lock down. Even her Treasurer, Dominic Perrottet, disagreed with the lockdown in Cabinet this week, and Health Minister Brad Hazzard publicly said that we need to learn to live with the virus. It was a point that Berejiklian disagreed with. The Prime Minister, meanwhile, is facing blame for a lack of vaccine supply, and this issue is such a serious one that at this point it is likely to cost him the next election. This is turning uglier politically by the day.